Welcome to Enduring Training for Directly Observed Therapy Workers. This is Lesson 7, Monitoring for Side Effects. The learning objective for this lesson is to list common side effects associated with anti-TB therapy. We will discuss side effects and drug toxicities associated with these medications. Why do we monitor patients under treatment? We monitor the patient because the medications are pretty potent and can be harsh on the body. DOT allows us to recognize adverse reactions so that we can intervene quickly, allowing the patient to remain on treatment without interruptions. This aids in preventing further morbidity, minimizes treatment interruptions, reduces opportunity for medical mismanagement, aids in avoidance, the development of psychological intolerance, and I'll explain a little bit more about that later, and provide support allowing for a therapeutic relationship between the DOT worker and the patient. Let's start off by agreeing that all medications have side effects. Have you ever looked at the package insert for Tylenol? The label cautions you to get emergency medical help if you have any of these signs of an allergic reaction, such as hives, difficulty breathing, swelling of your face, lips, tongue, or throat, and stop taking this medication and call your doctor at once if you have a serious side effect, such as low fever with nausea, stomach pain, loss of appetite, dark urine, clay-colored stool, or jaundice, which is the yellowing of the skin and eyes. This is not a complete list of side effects, and others may occur. Call your doctor for medical advice about side effects. You may report side effects to the FDA. So these are pretty significant side effects from a medication that we take regular without even thinking about it. These medications' side effects are some of the same side effects we see caused by TB medications. For the most part, TB patients complete their treatment without any significant adverse effects. However, there are a few patients that do experience adverse effects. Because we don't have a way to determine who will have an adverse reaction to medications and who will not, it is important that patients be monitored during treatment so that adverse effects can be detected promptly and managed properly. We are also limited to the medications we have to treat TB. So when a patient does identify experiencing side effects, the doctor will consider the risk-benefit ratio of the medication used. So, be sure to take time to explain the medications and their beneficial effects and possible side effects or adverse events, explaining that the benefits provided by the medicine may still be worth the risk, depending on the factors including the seriousness of the underlying TB disease. Side effects are unwanted symptoms caused by medical treatment. They are also referred to as adverse effects or adverse reactions. Any medication can cause side effects, particularly if they are not used as prescribed, and the risk of having side effects and even the severity of them varies from person to person. Side effects can range from mild side effects to more severe or even life-threatening side effects. Experiencing side effects are the most common reason why a patient is non-compliant to treatment. Imagine taking a medication that makes you feel nauseous for 6 months, at least. I bet you'd want to check your medications too. Here are some additional side effects as an overview before we go into more specific stuff. Psychological intolerance is when there's a mental barrier of some sort. So a patient may experience a side effect like nausea or fear of experiencing a side effect by simply thinking about the medication, seeing the DOT worker, or even smelling the medication. In this case, we need to take some extra time to talk with the patient and try to get to where the fear is coming from. This too should be shared with the nurse case manager. They may have some tools for assisting you and the patient. This also poses a real threat to adherence, so it is important that this is addressed. Here is a little table highlighting side effects of the first-line drugs. Some of these side effects will be identified via the lab work, but for the most part, you will be the one looking for these. This is a reference for you and should not be shared with the patient, unless the patient is a nurse or a doctor with a high health literacy and knows what thrombocytopenia is. Here is a table with the second-line drug side effects. You will notice that not all the second-line drugs are included here. That is because the other drugs are administered by a nurse in a hospital setting, so I am focused on the ones that you will see. Again, this table is a reference for you and should not be shared with the patient. There really are a lot of side effects to TB treatment, but then there are a lot of different medications that the patient is taking. Remember how many side effects Tylenol had, and that was just one medication. For the patient, it is best to start off with a visual, something that gives both of you a reference so that you both have the same understanding of the side effect. I'm going to focus on the actual side effect, using the terms listed in the previous two tables and providing an explanation for each. GI upset can mean any general upset of the stomach, like indigestion, nausea, vomiting, and gas. It's important to explain to the patient that these are common in the first few weeks of therapy, and that with a light snack may be helpful. Be sure to encourage hydration throughout treatment. If your patient does report some nausea or vomiting, you need to ask follow-up and clarifying questions to aid the nurse and the doctor in their next moves. Find out when it is that the patient feels nauseous. Is it right after taking the medications? Is it all day long? Has anyone else in the house been feeling ill? Etc. If the patient reports vomiting, ask about the frequency. Did the patient eat anything new? Also be sure to inquire if the patient has taken any medications to offset the symptoms. Medications and herbal remedies may interfere with TB treatment, so it is important to immediately report this to the nurse. If a patient reports a rash, ask where it is. What does it look like? Does it itch? When did it start? Has it spread? What makes it feel better or worse? Have you had any insect bites? Be sure to question them about new soaps, lotions, perfumes, laundry detergents, etc. Some rashes are mild and often resolve a few weeks into treatment, and usually do not require stopping treatment. The doctor may prescribe some Benadryl or other type of antihistamine to treat the symptoms and continue treatment. This is a medical decision and should be made by the doctor. Rashes can become severe quickly, so it is important to continuously ask the patient about any rash they may have. Hepatotoxicity is a chemical-driven liver damage, either due to prescribed or unprescribed medications. Patients with underlying liver disease, such as hepatitis B and C, who suffer from alcoholism, or have recently given birth within the last 4 months, are at greater risk for hepatotoxicity. The nurse will make you aware of any increased risk and monitoring prior to you seeing the patient. As with any side effect, the earlier we can detect side effects, the better. The unfortunate part about this is that many of the medications have the same side effects, and finding the one that is causing the problem can take time. Signs that the patient is experiencing peripheral neuropathy are complaining of tingling, numbness, or sharp stabbing pains in the hands or feet. You may hear them say that their limbs feel weak or heavy, as if their legs or arms are locked into place, and they may mention that they're always dropping things from their hands. This is their way of telling you that they are experiencing side effects, so be sure that you are really listening to them. Flu-like syndrome is feeling like you have the flu without actually having the flu. The patients may be experiencing fever, chills, muscle pain, and headache associated with treatment. Rifampin and rifabutin will cause the patient's bodily fluids to change a reddish-orange color. It is very important that they know this because it can be a little freaky if you don't know what to expect. If the patient uses contacts, you should explain to them that they should use their glasses because the medication will stain their contacts. And then there's this picture here of Michael Jordan that no matter how many times I've seen it, still cracks me up. It's funny and it's educational at the same time, and those are two of my favorite things. Uveitis is specific to rifabutin, which may be used in treatment of TB disease regimens, but it is one of the medications used in the 3-HP regimen for TB infection. Signs of uveitis are a redness and irritation of the eye, blurred vision, eye pain, increased sensitivity to light, or floating spots before the eyes. Arthralgias is joint pain. Never ask the patient if they are experiencing arthralgias. Ask them instead if they have any pain in the joints, and point to your joints. Gout is associated with PZA and is rare but possible. Signs of gout include burning pain, stiffness, and swelling in joints, most commonly associated with the big toe. Optic neuritis is associated with ethambutol. Signs of optic neuritis include pain in the eye and temporary vision loss. Changes in the skin are associated with cycloserine. Signs associated with skin change are facial swelling, tongue swelling, hives, skin pain, blisters, and shedding. Photosensitivity is an oversensitivity to light. A sign of photosensitivity is sunburning easily. Endocrine effects are associated with ethionomide. Signs of endocrine effects are loss of hair and acne. In men, they may experience impotence or swelling of breast tissue. In women, it may cause menstrual irregularity. Remember that any medication that the patient takes, such as Tylenol, has its own set of side effects, and the medications itself may cause our medications to act funny. Certain foods can mess with our drugs too, so it's important that we know this kind of information. In closing, side effects are common with TB medications. Ask about side effects with each visit. Some side effects that seem minor, such as nausea or vomiting, may not be. If the patient reports side effects, do not give the TB medications. You must first consult with the TB nurse case manager or doctor. When obtaining information on side effects, ask the patient when the problem started, how long it's lasted, and how often it occurs. Side effects should be reported immediately. Be sure that you are communicating on a regular basis with the nurse case manager, even if it is to let them know that the patient is doing great. Remember to include them in the patient's successes as well. They are working hard to make sure the patient gets through treatment too. You don't have to be a nurse to assess the patient. Simple observation of the patient can give you clues to the patient's overall well-being. Listen to the patient. Be checked into what the patient is describing. They may have a different way of describing symptoms to you, so be sure that you're listening. Here are some additional resources that are free and easy to access. Personally, I think that the core curriculum on tuberculosis is a little easier to read than the others, but they're all good references for your library. Thank you.